right. We're good to go.
How do I get out? Okay, let me get out. Oh, good. Yes. And we got the same. Yeah.
Yeah. So
Okay,
we're good to go.
we're ready. We're ready. Yeah.
All right, Delaney, we are good to go. Sorry.
Good morning, everyone. I warmly welcome all of you to University of South Australia's Allied Health, Clinical and Health Sciences webinar for international students. When talking about University of South Australia, it is ranked #1 in Australia for quality education in health sciences. And at present, there is a high demand in Australia for qualified professionals in this field. In order to talk about programs available at UNISA, we invited Ms. Sharon Blue, Manager International Business Development, and Ms. Rahama Mashood, International Recruitment Officer from UNISA International. Over to you, Rahama.
Thank you so much, Delaney, for that welcome and the introduction. So yes, just like Delaney said, I'm Rahma and one of the international recruitment officers here at UniSA. In today's session, I will be doing a quick introduction of where we're located, which is Adelaide, and also about the university. And then I will hand over to Sharon, who will be giving you more information about the study areas that we are discussing today. So let me just start by sharing my screen. I'm gonna need someone to confirm if you can see my screen. Let me just go into the bigger one. You can probably see, can you see the full view, Delaney?
Yeah,
perfect.
Yeah, okay.
Amazing. So once again, welcome everyone for today's session. We're talking about University of South Australia today, and we are located in Adelaide. Adelaide is actually the capital of South Australia. Now, you're probably wondering, why should I actually study in South Australia? And my answer to that is, why shouldn't you actually study in South Australia? Because can you see that beautiful picture in the background? That's actually Glenelg, one of our beaches. And we've got a lot more beautiful beaches like this. And I know both Maldives and Sri Lanka are island countries, so you obviously do love your beaches, but we also do have beautiful hills, and you can actually go on hikes on those as well if you want to. And not only that, we're actually one of the most livable cities in Australia, and we are one of the most affordable as well. Now, basically, if you're going to look at affordability, giving you a comparison of some bigger cities like Sydney and Melbourne, we are 12% more affordable than Sydney and up to 11% more affordable than Melbourne. And if you actually look at cost of living, you can actually cover your cost of living by just doing part-time work here in Adelaide. So as an international student, you will be able to work part-time, which is about 24 hours a week. And the minimum wage will be about $21 per hour. And based on this part-time work and this minimum wage, you will actually be able to cover your cost of living. And I've given you a comparison in Sri Lankan rupees, in Maldivian currency, on the screen as well, so you can actually get a better understanding as to what kind of cost of living expenses we've got here and how you can actually cover the cost of living plus save some money by just doing part-time work. And not only that, Adelaide, yes, is amazing, but we also do have more reasons for you to study here in Adelaide. So once you complete your program of minimum 2 years, you will actually be eligible for post-study work rights wherever you study in Australia. But if you study in Adelaide, you will be eligible for an additional year. So if you study in Adelaide as a bachelor's graduate, you will be eligible for 3 years. As a master's student, you will be eligible for 4 years of post-study work rights. And as a PhD or research student, you will be eligible for 5 years. So that is the highest you can get if you actually look at all the comparisons on the screen. In addition to that, the Australian government has also announced that certain areas of study will be eligible for 2 more years of post-study work rights. If you need more information about that, please get in touch with EdLocate and they will advise you on what areas of study is actually eligible for this. So that 2 years will be on top of the years that are listed on the screen here. Now, if you do want to get any additional information about Adelaide, studyadelaide.com will be the official website. These guys are the official government body that is responsible for promoting Adelaide as a destination for international students. So you'll be able to get any information about Adelaide on their official website. They also do have a lot of extra events, and they do a lot of sessions for international students to allow you to kind of meet other students and to kind of mingle in and network in Adelaide as well. And another misconception that we do have about Adelaide is that it's hard to find jobs here in Adelaide. So Study Adelaide has actually tried to find a solution for this as well. We honestly think it's a misconception because there are a lot of big companies based here in Adelaide and a lot of job opportunities available. And if a student wants to apply for a job while they're in their home country, before they even come to Adelaide, they can go on to Study Adelaide's job shop, again, available on their website, and they can apply online for part-time casual jobs. Now, you do know Adelaide is great. Now, you're probably thinking, why should I study at UniSA? Why shouldn't you study at UniSA? Because we are one of the world's top young universities. We are ranked in the best 50 universities under 50, both in QS rankings and Times Higher Education rankings. On top of that, our graduates actually find jobs really fast. So we are number one in Australia for graduate employability. And this is not just South Australia, I'm talking about the whole of Australia. We got these rankings just about a week ago, so they are very new. They are the most updated rankings, and we are the number one in Australia. We are also within the top 10 in Australia for graduate skills. Now, that's about rankings. In terms of the size of the university, we are actually the biggest public or state university in South Australia in terms of student numbers. We currently have about 37,500 students studying with us, out of which about 20% are international students coming from over 80 countries. So in terms of diversity in our classrooms, you will see a lot of students from different cultures and backgrounds. We do teach over 200 degrees. We will not be touching on all the programs today. We will only be touching on a few of them, and Sharon will be touching on them. These 200 degrees are actually taught across 7 academic areas, and we do have 4 metro campuses and 2 regional campuses at UniSA as well. Now, that's in terms of the size of the university. Now, in terms of the service that the university offers, we are number one in South Australia for student support and student satisfaction. So our students are quite happy with the service and the education that they do receive at UniSA. And if you do have any additional questions about other services that we do offer, I'm more than happy to take those questions and answer them, but we will not be talking about them today because today's session will be focused on the study areas. What I mean by this is if you need more info about accommodation or any other services, reach out to us. And with that, I'm going to stop sharing my screen and I'm going to hand over to Sharon, who will be talking about all our allied health and clinical and health sciences programs today. Over to you, Sharon.
Thank you. Please give me a second to work out sharing. Yeah.
It can be a little tricky sometimes when you've got multiple screens.
Yeah. Stop. Yeah.
Okay.
Yeah, it's working.
It's working, but we are at nursing, so I think we'll need to go back to the top.
I know. Give me a little time. Thank you. I'm getting there now. Thank you very much. Okay. I feel that I'm not seeing anyone, so but at least I'm glad that we got this system and it's all working. And thank you very much, everyone. I know I can't see you, but obviously you can see the crew here. So I'm Sharon Liu, Manager International Business Development at the UniSA International. So I work very closely with my colleague Rahma, who has just been talking to you, sharing information about UniSA and a bit of Adelaide. So my job is actually to looking after the recruitment for clinical health science and allied health programs. So I'm covering 2 academic units or faculties. And then what I'm going to do actually to start with this screen. So we're very lucky that University of South Australia, so 2 campuses that we offer health science and clinical health science programs are located right in the city. And we also locate very much next to or together with the Adelaide Biomedical City. So within the 2 or 3 kilometers, we have highly concentrated medical services and research services for South Australia, and also, working very closely with the rest of the country and even the world. So here you can see that we have a campus called University of South Australia City West Campus, but then at the same time, there is also Royal Adelaide Hospital, which is also sit very closely with us. And then next to it, there is SA Health Medical Research Institute, SAMRI, which is really, really nice, really big. And they're doing a lot of high-end research, and UniSA is working very closely and part of that. And then we just completed another building called SAMRI number 2. So it's another medical health science research. And of course, over here, we have University of South Australia Cancer for Research. So with all of these health research, UniSA is sit right in the middle of the medical research precinct and work very closely with all those organizations together. So now I just want to focus on a few of the programs. And apart from that, what I like to highlight here is here are the list of the programs that we offer within the university. We call health sciences or clinical health science and allied health. So I'm not going to talk through all the programs here, but then if you see the highlight, these are the programs that I'll be talking through at today's session. However, you always welcome, to apply all the other programs that you might be interested. And if you have questions, you're always welcome to get in touch with us and inquire with us. So the first program I'm talking about is a Master of Health Services Management. So this is a very popular course among international students as well as domestic students. It does provide students with the high end of knowledge to allow students not only learning about the health services management, the policies, but also they need to understand about how to manage and understand the policy, and understanding the data and how to make the system more viable. So I'll come to the next slide. But just before that, I'd like to advise that this is a 2-year program, and IELTS requirement is 6.5 with writing and speaking 6.5. And we have 2 intakes, February and July. So the 2024 annual fee is $29,400. So at the moment, if you're applying for SP5, we call semester 2 for the July intake, we don't require any relevant degree, but from 24 onwards, you will be requiring a relevant degree. And by relevant degree, we mean if you have a health science related degrees, chemical, biology, biomedicine, you'll be eligible for entering into this program. So here is just a rough structure of the program. I'm not going to talk through the program, but what I like to highlight here, as you can see, it's about training or educating our students to be able to understand how the system works and be able to design quantitatively, with methodologies involving nursing, midwifery, and health science or health research. It also allows students to understand the quality and safety for health and aged care, and strategies for healthcare managers, and of course performance review, which is part of the, as a leader in the health professional industry. So in the final year and the final semester, students will do a capstone in health services management. And that means students will be working in a project, and we call it, a placement, that you'll be connected with the industry and working in hospitals or community health system. So it's a great program. And here, what I like to say that all the program at UniSA, allied health and clinical health science, they will be embedded with placement and industry project as part of the degree. So talking about a career outcome, students will be able, once you graduate, there are plenty of jobs, and the professions that you'll be entering could be medical or hospital administrator, primary health organization administrator or manager, aged care administrator or manager, health and welfare services administrator and manager. So it's pretty broad. Okay, so the next degrees that I'll be touching on briefly is, and they are very popular at UniSA, is a Bachelor of Physiotherapy Honours, Bachelor of Clinical Exercise Physiology Honours, and also Occupational Therapy. So as you see, all these are 4-year program. There is no prerequisite. So if you finish a high school, you have a Australian equivalent ATAR, and then Australia ATAR or equivalent GCE A level of 12. Then you're meeting the academic entry requirements. There is no prerequisite. However, we have assumed knowledge. So we understand that you should be able to have a background like that. So, and these programs, physiology, physiotherapy, clinical exercise physiology, and occupational therapy require IELTS 7.0 for all band. And as you can see from here, they all have a lot of clinical placement as part of the degree. So moving into the next slide, Bachelor of Physiotherapy is accredited by Physiotherapy Board of Australia and also Australian Physiotherapy Association. And also occupational therapy has accreditation or recognition by World Federation of Occupational Therapists, Occupational Therapy Board of Australia, and Occupational Therapy Council. So it's highly accredited degree. So when you do any of the degrees, students will actually use a lot of the we call lab space. And at UniSA, within the health and medical health area, we have the most number of laboratories for students to be able to practice before they're doing the placement. So say, for instance, students in these degrees, they will be using the biomechanic lab, motor behavior lab, exercise physiology lab, and then high performance exercise, human performance, resistance training labs. And of course, there is anatomy labs, physiology labs on campus, and clinic, and we have an on-campus clinic or clinics. And then we also have a UniSA sports gym. So sports gym also allow our students to get practice through as part of their study. And here is just another chart to show that all of these degrees facilitate, so the physiotherapy, you become a physiotherapist and it's accredited. And then occupational therapy, you be becoming a occupational therapist after you finish the degree. And then if you do the clinical exercise physiology, you will then become a clinical exercise physiologist. And they all accredited degrees. So I think it's easy to understand what physiotherapists do, but probably need a little bit of explanation on the exercise physiologist. So we say that when you finish the degree as accredited exercise physiologist, you can prescribe and administer exercise as medicine. So you can prescribe medicine, or you can also administer exercise as part of the health improvement as a in that profession. And of course, the aim of doing this job is to prevent or manage acute or subacute or chronic disease or injury, assisting the patient in restoring to their optimal physical function, health or wellness, for people who are having risk or developing a risk. So we've seen on campus, because we have the facility, we have the clinic, we see patients coming in and they're actually using our facility, to get treatment. So so apart from the labs, we actually also have a clinic on our campus, and it's out facing. So, and we also have physiotherapy clinic as well. So that provide not only our students to be able to do the clinical placement, but also facilitate and providing external, support to our community. Here are some examples. So as a physiotherapist, exercise physiologist, occupational therapist, you have a broad career outcome, and there are lots of areas that you can work from in hospitals, private practice, sports and exercise service, rehab centers, and home and community services, and lots of areas. I'm not going to read all of them. So I'm just moving to the next program, Bachelor of Nutrition and Food Science. So this is a very interesting degree, and it's a 3-year degree. So at UniSA, this program is also accredited by Australia Institute of Food Science and Technology, and also Nutrition Society of Australia. And when you graduate, you become associate nutritionist. So what we think that you need to have, you need to do, is that it's important to have a passion and interest in nutrition and food science. It's actually not only for this degree, it applies to many other degrees as well. It's a 3-year program. You need A-level 7 or ATAR 75, and IELTS is 6.5 overall. And then in terms of tuition, it's obviously, I'm not going to talk about that. It's per year. So for the food and nutrition at UniSA, we have the best facility in Adelaide, the state-of-art facility that costs $1 million for the university to do this commercial kitchen, as you can see in the picture. And so students do a lot of exercise and practice and cooking and trying to make to see the foods, not food preparation and food science, but at the same time with nutrition, being considered as part of that. So we also have a sensory lab and a microbiology lab as well, when students doing the program. And here are just a few photos of students doing this program and the lab. Okay, so talking about the career outcome, there are also a variety of jobs that students can seek for in 2 areas. Depends on what they study. They have stream of food, and they also have a stream of nutrition. And students can pick and choose and finding a job in that area as a community nutritionist, or food policy advisor, or maybe working in a food company, and then being involved in the food industry. So we understand that less students are choosing a double degree, but I'd just like to flag that we do have a double degree for Bachelor of Human Movement and Bachelor of Nutrition and Food Science. And we also have Bachelor of Exercise Sports Science and Bachelor of Nutrition Food Science. So we have 2 double degrees, and each of the degree is 4 years. And then it requires similar entry requirement as food and nutrition. The arts requirement is the same. Okay, so here is another interesting program, and students probably, hard to understand. Okay, what is a Bachelor of Laboratory Medicine? So this program is an honors program, so it is a 4-year program, and it's a kind of a fixed term, within the Australian system. So the program, most of our health science programs, we have only one intake, only February intake. And then some of the programs require 6.5 IELTS and some requires higher 7. So this program I'd like to highlight here is that it does require a prerequisite. So you need to, in your year 12 exam, you need to have either chemistry or physics or biology. But in reality, I think chemistry and biology are more important than physics in doing this program. So the program also has lots and lots of placement, as you can see. So students will spend 13 or 20 weeks as their clinical placement, or we call professional practice, in a pathology lab or like a clinic in their 3rd year and the 4th year. So most of the students do their practice, professional practice or clinical placement in Adelaide, but there are small number of students can choose to do interstate or overseas. So this program is accredited by Australia Institute of Medical Scientists. So that means when you finish the program, you can call yourself as a profession medical scientist. And with this medical scientist qualification, you can work anywhere in Australia. And it's a recognized degree. So what the medical scientists do is that when you're doing your study, you will be focused on identification of illness. And this is what you actually do as a profession as well, determining the cause of the disease, suggesting possible treatment, monitoring the effect of treatment, and tracking the patient's progress. So this is what you do, this is what you learn, and what you do after you finish the degree. And we also have a lot of labs and facilities allowing students to get practice through their study. Right. Career outcome, of course, students will be working in pathology labs in the public system or private system. So public system would include in the hospitals, and private system will involve a lot of pathology labs. One of them, a few of them that are very, very famous in Adelaide, and we have our students, working in those labs, even they get a job, during their placement. So pathology, medical scientists, when they finish, they will have a start salary of 66,000 per year, just for reference. Okay, so now I'm just briefly talking about this biomedical science. So biomedical science is also very popular for Sri Lankan students. So at UniSA, it is a 3-year program. And the first year of this program is very similar to to Bachelor of Laboratory Medicine. So there are lots of matching courses as a foundation for this program. So a lot of students because during the degree, student will actually do a lot of biology testing, understanding the biology, and then understanding about the vaccine development, genetics, and neuroscience. So some students would use that as a degree to progress further into research, because you'll be the specialist, in working in the in the laboratory. So in the third year, students will be doing an industry research project for 13 weeks in the active research. Active research means it's a research which is continuing on, and the students will be working with the research team in as part of this program. So I'll just move to the next one. Bachelor of Nursing is very, very popular at UniSA. Uh, and it's a 3-year degree, and there is no prerequisites. The IELTS requirement is 7 for all the individual band, and you have to provide objective tests. So there is no pathway to that, like through English language courses. And of course, this degree is accredited by Nursing and Midwifery Board of Australia. So when you finish the program, you'll be becoming a registered nurse. And of course, we also highly ranked with top 100 in the world for nursing, and also with #1 in Australia for quality and education in health. So we're very proud of that. So also the students are doing a lot of placement as part of the degree. Students have to complete 1,000 hours of clinical placement, and then they're doing through 5 different placements in 3 years' time. In the first year, second semester, students will be doing 40-hour placement, and then the second year they have another 2 placement, and then third year there are another 2 placement. So students will do a lot of placement as part of the degree. And of course, apart from the placement, normally what we do is students have to do some labs training within the university before they go into the placement. So they understand what they have learned theoretically and then putting them into practice. So they're more confident and ready for going to the clinical placement. So on campus, we have a simulated hospital and health service that are exactly the same as hospital ward and clinical units. And we have 68 beds and 13 clinical units across 3 of our campuses. So students also have to do 170 hours of practice before they actually going into the clinical placement. So here is just a photo of showing our clinical on-campus lab, and we call Horizon Hospital and Health Services, HHSS. So students will be paid fairly good, as a registered nurse. So when you work, start from the first level 1, you're getting 59,000. Between different. You start with the first level, step 1, and then you're moving into a higher level. But over the years, as a registered nurse, you can easily, earn over 100,000 per annum. Right. So pharmacy at UniSA is also a very good program, very popular. We're the only university that teach this program in Australia, in South Australia. So we also ranked very high, so a top 150 for pharmacy and pharmacology. So obviously, students finishing this program, they can be a pharmacist. So this is the aim of this program, and also the program provide a lot of practical and clinical placement as well. We're also a member of National Alliance for Pharmacy Education, so we're one of the leaders in pharmacy education in Australia. So there are 4 of the universities that are in that elite group, and UniSA is one of them. So also briefly touching on Bachelor of Pharmaceutical Science, we also have this degree, and it's a 3-year degree. What I want also to mention is whether you're doing pharmacy, pharmaceutical science, or choose to do the double degree for pharmaceutical science and pharmacy, which is for 5 years, you need to have a prerequisite. So you need to have in your year 12, you have to have either chemistry, biology, or physics, same as laboratory medicine. So pretty much these are the only programs in our health related program that require a prerequisite. The rest programs do not require a prereq. So it's easy to understand what pharmacy do, but what about pharmaceuticals? Okay, so if you're doing pharmaceutical science in a 3-year degree program, you pretty much learn about development of drugs from the initial discovery through to the market entry. So in a simple word, that this is what you're going to cover. So the drug development, initial trial and discovery, and also market entry. By market entry means you could be, able to do, you can be able, depends on a few minor courses that you choose. You can also be, being a marketer for working in pharmaceutical companies involving in pharmacy drug sales. So the pharmacy program I like to mention here is a 4-year program. But what happens after? In the 4th year, students will be doing a lot of clinical placement. So they do 12 weeks clinical placement. But when you finish the degree, you then getting your first job. But your first job is a pharmacy intern. Is not as called a registered pharmacist. To become a registered pharmacist, you need to do an additional year of pharmacy intern training program. And this is not just UniSA. This is across all Australia. Any students who wants to become a pharmacist, they have to do the 4-year program. And at the end of it, they need to do 1 additional year pharmacy intern training program. But when you do the program, you actually already have a part-time job, or you have to have the full-time job, and then it's your first paid job to work as assistant pharmacist. And then when you do the program, intern training program, is actually you do online. Most of the program you do online, and then they probably on the weekend there are a few sessions that you have to come on campus. And UniSA offer the pharmacy intern training program. So this is something else to remember that when you do the degree. So these are a few of the labs. And this is also our pharmacy practice integrated learning suite, which is a replicate exactly the same as the pharmacist. So students will also get practice before they going into the industry to do the real placement. All right, so another interesting program is Bachelor of Exercise Sports Science. So UniSA also highly ranked for this program in the world top 100 for exercise and sports science, according to the new 2023 QS subject ranking. So we do really well. We're the first university that offer this program in South Australia. And also we do really, really well in research. So we're well above the world research in human movement and sports science. So we have students coming to study with us from European countries to do our degree. So we also top 50 for sports science under the Shanghai Global Ranking. So what does the exercise sports science do? So when they finish the program, students will become an exercise scientist, and it's accredited by Exercise Sports Science Australia. So students during the program, they will be, when they finish the program, you'll be able to design or implementing physical activity and sports specific interventions to improve performance and healthier society. So when you finish the program as an exercise scientist, there are a number of areas that you actually can get into as a job. So you can work in the fitness and performance area as a sports trainer, athlete development officer, fundamental movement trainer, or fitness gym instructor. So there are and strength and conditioning coach, sports coach, many. And of course, you can work in corporate health, education, community health, and preventative health and early intervention. And of course, you can get into race, you can continue with research. Actually, one of the reasons we're doing really well in research is actually we continuously having strong interest and PhD candidates who working finding a research area and at UniSA. So the program also provide at least 140 hours of industry placement in their final year, and these are just a few examples of the industry partners that we work with. And we have lots of labs associated with this program. There is one more. Okay, I think we come to the last program that I'm going to talk about at UniSA Health Science, and it's public health. Public health is becoming a very important degree, and our graduates are quite well sought after, especially since COVID, because the public health provide knowledge and also preparation for students to be able to develop the skill in planning, managing, evaluating healthcare policy and projects and programs and services. So then it also have a big diverse areas, when they're doing the degree, and also when they come to the professions, they can work in the area of health promotion, ethics and policy, human biology, epidemiology, as well as global and national and Aboriginal issues. So that's what students actually do as part of the degree and preparing them for their future careers. So the degree also provide at least 200 hours of industry placement and projects. So that is really, really good. And that's what I said that, in all the degrees that we offer in health and clinical allied health area, we provide industry placement. And that will allow students to get career ready. And that's why, like my colleague Rahman mentioned in her first presentation slides, that UniSA is #1 in the country in Australia for employability. It's because all of these clinical placement and industry placement that we offer. So what can students do after they finish the public health? They can be health promotion officer, community development officer, public health research officer, and epidemiologist and data analytics. This is a very interesting area, especially during the COVID. So we're very strong in that area as well in research, but also in preparing our graduates to work in that area. So I think that by saying that this is the last slide. So I think now we should be open to questions.
Actually, before we go to questions, Sharon, just 2 more slides. I know it's been a bit of a long session just to touch on scholarships. So thank you so much, Sharon. Very, very, very informative session. And actually, most of the programs that Sharon spoke about today are eligible for UniSA scholarships. There are a few programs that are not eligible for scholarships, but you can get more information on that on our website. But let me just quickly share the information. I'll make this very quick. All right, so we've got that screen. I'll just quickly go into bigger screen. And there you go. So we've got 2 scholarships at UniSA. 2 main international scholarships. The first one is called IMS, or International Merit Scholarship. This is a 15% scholarship for the full duration of your course, and you do not require to submit a special application for this. Once you've submitted your application to study the program that you've selected, you will be automatically considered for this scholarship. And if you're a student applying for any of our bachelor's programs, the requirement will be a 9 in A-levels or 3C passes. If you're applying for any of our master's programs, which is the Masters of Health Services Management, as Sharon spoke about, you will need at least a 60% in your bachelor's degree, or a 3.3 on a 4-point scale GPA. And in order to make sure that the scholarship continues, you also do need to maintain a GPA of 4.5 out of 7 to make sure that it is maintained all throughout. Now, the next scholarship is actually the scholarship that we call the VC scholarship, or the Vice Chancellor's International Excellence Scholarship. This is a 50% scholarship, again, for the full duration of the course. However, this is not automatically granted. You will need to submit a special application, which is available on our website. Educate can help you with that. You will need to submit the application along with your normal program application as well. In order to be eligible for this, you need to have at least a 16 in your A-levels, or at least about 80 in your master's. Basically, if you're coming into master's, sorry, in your bachelor's. So basically, we only have 20 scholarships for this, so it's very competitive. Annually, we only have 20 available places. Very competitive. However, if you are eligible, please submit your application. And if you are selected, you will be sent an offer letter with the scholarship information. Now, that's about the scholarships. And if you do need to get in touch with any of our students, you actually can have a chat with UniSA ambassadors or our current students. So you can scan the QR code that's on my screen now, or you can take a picture of this and you can save it for later. What happens when you scan the QR code? It'll take you to our student ambassador page, and you are able to see their profiles. You can see what they're studying, where they're from, and you can actually select a student who matches your background and click to have a chat with them. You can have a one-to-one conversation with them, ask them any questions that you want to know. Now, if you need any further information about accommodation, living in Adelaide, anything like that, you can always reach out to Educate or to our student ambassadors. Now, with that, I'm done with my slides too. And it's time for question and answer, just like Sharon said. I'm going to stop sharing my screen now. Perfect. And I'll hand it. Yeah, Sharon.
Yeah. Just carry on to Rahma about scholarship. I just went to the website and had a look. So among the programs that I talked about just now, and also around health science, because there are exclusions, and the programs that are excluded from the availability of scholarship for international merit scholarship is physiotherapy and occupational therapy. All the rest programs are included in the international merit scholarship, provided the eligibility is based on your score.
And I can also see a question from Nisha on the chat. So you're asking, what do you mean by 16 for A-levels? Yeah, I'm happy to take that one. So basically, A-levels, we do grade your the grades are actually given a score. So what happens is if you get an A star, you get 6 points. If you get an A, you get 5 points, and it keeps going down from there onwards. A B will get 4 points, and so on. So based on the amount of points that you accumulate, you will actually be eligible for the scholarship. Hope that makes sense. And do we have any other questions? I am aware that we actually are a little over time. Are we good with time, Dilani?
The question,
Dilani, you're
right,
on
Rama?
mute. Sorry?
There's another question, right?
Yeah, so this depends on which kind of A levels that you've taken. So if you've taken local A levels, which is Sri Lankan local A levels, GC A levels, I know you don't have A stars. That means you will need at least 3 A's in order to be eligible. That will be a 15. And if you have taken your Londons, for all the students in Sri Lanka who have taken London A levels, or our Maldivian students, you take the London curriculum, which means that will be 2 A stars will be 12 and probably another A. Yeah, so I hope I've answered that one. Anything else?
Yeah, thank you, Sharon. I think it was a very good session. So informative, as Rama said, and comprehensive, I'd say, with all the information with industry connections and job prospects. Just one question from me. When it comes to physiotherapy and nursing, there's a quota, right, for these programs. Even for physiotherapy, yeah, there is a quota system, right? So how soon
Yes.
they have to apply, say, for February? Like when does the students have to apply normally? What is your suggestion regarding that?
Um, yes. So, Bachelor of Nursing and Bachelor of Physiotherapy, as well as Bachelor of Occupational Therapy, they are all quoted programs. So, which means they are highly sought after across, you know, the different countries. So students applying this program from everywhere. So my suggestion is that students should apply as soon as possible when they have all the grades and the transcript, allowing them to apply for. And so the way that our quota system works is based on first come, first serve. So getting an offer, I mean, unconditional offer that only unconditional offer you'll be able to accept. It doesn't mean that you guarantee a place. So you have to accept, make a payment, then you're logged in to the quota. You are actually at that point secured in having the place. So we always recommend, apply as soon as you can and accept as soon as you can.
Thank you, Sharon. Um, that's a question.
Yeah, that's
Your
exactly
reply.
what I was reading. I'm actually typing the response, but I don't mind actually reading it out loud. So we do have another question. If you're unsure about which degree to apply for, what should one do? You've also listed the programs that the subjects that you've taken in your A levels. Now, for this, what I would recommend is have a chat with Edlocate. They're the experts at this. They will actually have a look at your profile and they will recommend the right program for you. And if you do need any more information about any of the specific programs, you can always reach out to Edlocate and they'll come to us. And even myself or Sharon, we are happy to sit with you and talk through the program with you. But first thing to do is to actually select the right program for you. So for that, I would say the specialists are Edlocate. Get in touch with them. I was actually typing the response for that, but I'm just going to delete that.
And also,
Yeah.
just Yeah. So when I talk about the programs, I did mention about some programs that require prerequisite. And I just highlight again, the programs that require this prerequisite for chemistry, biology, or not mathematics, physics, is Bachelor of Laboratory Medicine, that is important, and Bachelor of Pharmacy and Bachelor of Pharmaceutical Science. That's all. If you want to do nursing, there is no prerequisite required. And if you want to do physiotherapy, it's not required either. So because they are highly quoted, but say for instance, in the worst case, you're not able to get a place, it is actually not the end of the world because there are so many other programs that you can choose from, and those other programs can also take you, to a good job, good career outcome after you finish the degree. So you can actually try to broaden yourself rather than limit your options.
Sharon, one more question. If someone wants to get qualified in midwifery, what is the pathway? Is it Bachelor of Nursing or is there any other pathway for them?
No, Bachelor of Midwifery in Australia is an individual degree. If students interested and wanting to be a Bachelor of Midwifery, they can also just use their ATAR or A-level score and apply for the Bachelor of Midwifery. We also have quota for Bachelor of Midwifery. So also students have to act really quick and really fast. And so also it works in Australia that if you want to be a nurse, you cannot be a midwife. And then if you become a midwife, you cannot be a nurse. I think there are always a bit of gap between these two programs. So what we suggest that you have a good think and then make a decision whether you want to be, applying for a Bachelor of Nursing or midwifery, and see which area you want to be as a profession.
So, any more questions? No, I think that's it, right? So, thank you, Sharon and Rahama, for joining, and thank you, everyone. For further details with regard to these programs and for your application procedure for next intakes in 2024, and the applications are still open for programs for July 2023 as well. So kindly be in contact with us and contact us on 077-177-00361. Rama, you want to add anything?
No, I just quickly wanted to say, so the quota programs that Sharon mentioned, they are very competitive. But other than that, any programs that do not have a quota, the last day to apply will actually be the 16th of June. That's the last day for you to apply. And the last day to accept any offers that you already have will be the 7th of July. So those deadlines will apply if we have places available or for programs that do not have quotas.
Yeah, thank you so much, Rahama. Yeah, thank you, Sharon. Then see you. Have a nice day. Bye.
Thanks, you.
Everyone.
Have a nice
See
day.
you.
Thank
Bye.
you. Bye-bye.